In this training, we're going to be discussing a variety of things. Just a few notes here before we actually get into the content of the course. We will be also looking at some handouts as well, and you should have those available. And I will be pulling those up on the screen as I talk about them. Also, there's a few videos, so you'll see me going into those videos, and I have turned on the closed caption when that is available. Here's our learning objectives and what we're going to be focused on in this presentation. We're going to identify and classify ethical responsibilities of therapeutic termination with clients. We're also going to describe examples of unethical abandonment and distinguish these particular actions from ethical termination. And then finally, we're going to discover methods of engaging in ethical termination practices and minimizing unethical abandonment of clients. So we know that it's important to look at termination as a key consideration in our work. Oftentimes we're focused on the beginning stages, the engagement, the assessment, designing interventions. But it's also very important to realize that although there can be different types of termination, really looking at the different ways in which termination impacts both the client and the therapist is important. So today we're going to be looking at both of those areas, the impact on the client and then also on the therapist as well. We also know that counseling termination requires a great deal of creativity and attention to detail. Although termination is often neglected in our field, we know that there are some really important aspects of it. And so today we're going to be looking at especially some of those ethical considerations. What I would like to do is I would like to start with a case vignette, and I'll read this aloud. Terrence stormed out of his house after another argument with his wife, Wanda. Wanda had threatened to file for divorce if Terrence did not get help with his explosive behavior and drinking problem. During the past 2 years, the couple fought frequently. Terrence was often verbally abusive toward Wanda and occasionally hit her. Terrence agreed to go to the local community mental health center for counseling. After completing the intake process, Terrence was referred to a clinical social worker, Marcia. Marcia and Terrence agreed to meet weekly for counseling. Terrence's insurance company authorized 10 sessions. At the end of the 9th counseling session, Terrence talked about how much he was benefiting from counseling and how for the first time he could talk about how he was affected by his abusive father. Terrence also began to address his alcohol problem and attend AA meetings. Based on his progress, Marcia contacted Terrence's insurance company and requested authorization for 10 additional sessions. The managed care company representative only authorized 4 additional sessions. During their last session, Terrence began crying and talking about how depressed he was feeling, how distressed he was about issues in his marriage, and how much he wanted to continue counseling with Marcia. Unfortunately, Terrence's insurance coverage had run out, and he could not afford to pay for counseling out of pocket. Marcia understood that Terrence was feeling vulnerable, but she did not think that her agency would permit her to continue counseling Terrence without payment. So this case illustrates a common example when clients come into counseling, and especially if they are under insurance coverage, if there's a certain number of authorized sessions, and then there's not that requested number of sessions that is approved by that insurance company, the client may not necessarily be ready to terminate. And so simply because the client is not ready and there may be a need to terminate, this brings up obviously a dilemma for the practitioner, such as Marcia. Should she advocate to her agency? Is that an option? How will that impact the agency's services and resources if they are absorbing the cost of some additional free sessions? How can Marcia terminate ethically with Terrence, even though he is in still such a vulnerable state and is still really wanting to continue in counseling?